New Jersey plastic surgery has been featured across the globe. Dr. DiBernardo is a world-renowned plastic surgeon. He is on pretty much every board in society you can think of. And he's also known as a pioneer for doing research into laser devices and always being on the cutting edge of innovation when it comes to the medical aesthetic space. So this procedure, MyEllevate, that he's going to talk about, he was at the forefront of that. So Dr. DiBernardo will go into this. He will explain, break it down, give you all of the information that you need. And again, remember, stick around till the end because he will be answering all of the questions that you have live after we announce the winners. So without further ado, I know we want to get right into it and everyone's really eager. So let me go ahead and bring on Dr. DiBernardo and you can go ahead and get started, Dr. D.
Okay, thank you, Ronnie. And we have a huge audience tonight. So welcome to our patient educational webinars. I'm Dr. DiBernardo, along with our other top plastic surgeons, Dr. Matthew Travato and Dr. David Turer. We welcome you to our webinar series. So let's get right into we're talking about the neck. What are the aesthetic problems of the neck? You can have loose skin, you can have too much fat, and muscle bands, those turkey neck or jowling bands, that all can create a problem. In this patient, she's younger, she has excess fat only. That's easy to just liposuction out, and that's a single problem. But as patients get older, then we need to do more things. The traditional answer was always the facelift, and that's been for the last 30 years. With a facelift, many people have a problem with their neck, but they don't want to go to the hospital. They don't want a long recovery. The downtime, it's a more expensive procedure, and it's something that deals with skin and fat, but other things. So we've seen a trend to smaller and smaller procedures, more minimally invasive. So the aesthetic problem that was really something big was loose skin. And research performed at our other arm, New Jersey Clinical Research Center, established laser-based systems to tighten the skin without surgery. We've moved on to radio frequency. We've moved on to other formats, but we're able to tighten skin now without scalpels. We've published this data in our major journals, the Aesthetic Surgery Journal, and we showed with this research that we can actually shrink the skin by doing these laser treatments by 35% at 1 month and 54% at 3 months after the treatment. We were also able to show that we can increase the rubber bands in the skin, those little fibers called the elastic fibers. And at 1 month, not much, but it builds at 3 months. We showed a 62% improvement over the non-treatment. So laser skin tightening, the device is called Precision TX. And in this photo, you're seeing tightening just from the laser. So that did pretty darn well. How long does it last? We have patients coming in now, like this one. That's her 10-year later photo. So these laser tightening, device tightening has been holding up as a treatment on its own, but now we're going to combine that with other things. We also have a very new treatment for patients who also have etched in lines in the skin of their neck. We add the POTENZA microneedling to that with these little they're called skin savers for different topics like firming. We can drive those growth factors into the skin and do that during and after the procedure to enhance the tightening of the skin and create a more youthful and tighter skin. This is an image of how that POTENZA works. It drives energy down and it pushes those growth factors into the skin. But then the third problem are the muscle bands. That the people will call that the turkey neck, those cords that get there and grow as you get older. And that was the reason we couldn't really treat many patients with our minimally invasive procedures. We could get fat with liposuction, we could get skin tightening, but this was the last area we could not do until this great invention by Dr. Meller. The Wall Street Journal called this, especially during COVID, the Zoom neck. Everyone's on these screens, but you still see their necks, and you have to hide them if you have those unsightly bands. We've seen many technologies, and these are all Facebook ads by Ulthera for skin tightening, other non-surgical lifting, but whatever treatment was done, Kybella is an injection for fat, those muscle bands were still there, and no one was able to treat them without a large surgery. And with all these treatments, this is what was being looked at. So we really needed a minimally invasive treatment of the jawline that could help these. And that is the missing link, which is the MyEllevate procedure. It's percutaneous, meaning little pokes are placed, no incisions, no sutures. We can do it with or without fat removal, with or without skin tightening, using this ingenious light-guided rod that's part of the procedure. And who is a candidate? We're going to get into that. The candidates are those who don't need a full facelift, who have excess muscle, loose skin, and the muscle bands, and want to have this done either under local anesthesia, which is the ELEVATE procedure, or for the older patients, we need to do a little bit more in the back, and that's called the ELEVATE Plus. I'm going to stop right here to invite some of my dear colleagues, leaders in the field in aesthetic plastic surgery, to say a few words. We're fortunate. We'll start with Dr. Greg Meller. He is the inventor of MyEllevate. He's actually on vacation, and he's coming to us from California. Greg, can you hear us?
Yes, I can. So great to join you today, and congratulations. What a great attendance. Barry, I remember when we met just a little bit over 2 years ago, and I showed you what I was working on, and to see where you have taken it is pretty amazing. It's basically what we're talking about is light-guided suture delivery, you know, being able to sew those muscles underneath the neck without opening it. And Barry's done hundreds of he's done hundreds of patients, but it's great to be here, and congratulations. And I'm so looking forward to seeing your results today.
Well, thank you, Greg, and stay on, because I'm going to invite my other good friend and colleague, master plastic surgeon, Dr. Jason Posner from Boca Raton, Florida. If there are any patients on who are down in Florida or have friends in the Palm Beach, Boca area, you can certainly go down to see Jason. And certainly if there are patients on the West Coast, Dr. Meller's in Beverly Hills, and he'd be happy to see you out there. So Jason, you on?
Hi, Barry. Hi, Greg. And
who we got with
Barry,
you there?
who is this? No, not bye-bye. We're just say hi. Special request by Dr. DiBernardo. This is Frosty. It's past their bedtime.
Oh boy. Well, thank you for coming on, Frosty. So
hi,
Jason,
Frosty.
you've done this about as long as I have.
Yes.
And what do you want to say to our patient? Oh, Frosty, hold on. Let the doctors get in there. Jason, what do you want to say to all these patients on here? You've been doing this for a couple of years now. Also, how has this changed what your patients have been coming in and asking for?
I think you and I owe Greg a big debt of gratitude, for this procedure, because this revolutionized our practice. I mean, you dragged me to breakfast to hear about it in San Diego, and I think I spent more time talking to Greg's business partner about the movie business. But when we in a few months after that, Greg came to Florida and trained us both, and after that, we started doing the cases and doing more and more and more and more, and we started teaching. We've done, between the three of us, we've done quite a few by now. The results are spectacular. It just gives us another tool that gives amazing results with minimal downtime to the patients. for younger patients, for older patients, for patients who don't want a facelift, for patients who previously had a facelift. There are so many indications for it, and most of them are done under local anesthesia. So it's absolutely changed my practice.
And one last question to both of you. What I've found, especially lately, is there have been so many patients that didn't like this area, but they never came in. They wanted to do something badly, but they just didn't want a facelift. They didn't want that surgery. And for us, it's just really changed. It's given the patients such another good choice that actually allows them to want to do something now without a major procedure.
Oh, absolutely, Barry. And I would say this, you know, for me out here in Beverly Hills, California, being able to offer something that works and that is less invasive and lasts many years has been a huge boost to my practice. And it's not a thread lift. A lot of people think it's a thread lift. They just don't work. You know, they last less than a year and they don't work in the neck at all. So it's an amazing new offering. This is brand new. I hope everybody on here today knows this is brand new technology.
And yes, I think the doctors on here are the pioneers, but I think what you're going to see over the next few months and the year is that this is going to be really a mainstay in facial aesthetics. So anyway, gentlemen, thank you so much for coming on. Feel free to stay on. We're going to move along and try to get to hear from some of the patients. So have a good night and thank you so much.
Thanks,
Bye-bye. Bye-bye.
Bye, Frosty.
Bye-bye. Bye-bye. Hey, now we got it right. Bye-bye. Bye-bye.
So this procedure's for the birds, you'd say, wouldn't you? This is what's happening under the skin. The ELEVATE suture is going in to these little bands under there. And when we put it in the front, around to the back, and then pull it tight, you get that crisp neck angle. And this is going to hold it in position for years. So that's what's going on. That's what we're talking about with all of these. Looking at some real patients, this is a before and after of someone 2 days later. You can see there's not very much swelling, bruising. The punctures are still there, but starting to heal. But you already start to see a difference. And that's only 2 days. Here's someone who's out 2 weeks. You see the banding is gone, the definition's coming in. And if you wait the 2 weeks, you're starting to really become presentable at that time. In terms of the skin tightening with the laser and the devices, you can see 1 week it's looking better, 3 weeks it's better, and that skin tightening will keep improving up to 6 months. And this patient is 56 years old. For someone who has more fat, you can see that's removed and greater definition, as you see here. And someone, this is the typical patient. Lynette spoke on one of our previous webinars, and you can see how that hanging muscle has improved. And this is only her 1 week result. So we like to hear from our doctors. They're very helpful, but I think you as patients really want to hear from the patients of what they have to say. So again, we have a few patients on with us tonight. Some are regular ELEVATE, some are ELEVATE Plus. So let's hear what they have to say. So our first patient is going to be Pamela. This photo is, she had an ELEVATE. She also had her eyes done with the TEMPSURE, which we'll talk about. It's doing, getting the excess eyelid skin without a scalpel. And this is her side view. This is only 4 days later. And she had the laser tightening of her skin and the TEMPSURE to her upper eyes. You can see 4 days later, there's a little bit of bruising and new neck definition. Here she is 11 days later, bruising starting to go. Things are starting to look more normal. And here's her 3/4 view at 4 days and 3/4 view at 11 days. So, okay, well, welcome, Pamela. And we have a large audience of patients on tonight. And you had the regular ELEVATE procedure. So could you share with them perhaps what what was bothering you, and how did you choose this to have this done?
Dr. DiBernardo, I want to thank you for introducing me to this procedure. I saw one of these videos that you have done, and I came in for a consult, and I liked the fact that it was minimally invasive. There was a short recovery time, that you were awake during the procedure. I didn't have to go under general anesthetic, and there was no cutting of my face. And I wanted something that would also, you know, give my face a more defined jawline.
So I think I'm going to ask everybody a particular question. And I think the question I want to ask you is, you were on one of these, you were watching it, now you've gone through all of it, and everything we're showing here, is that true? Are we saying the right thing?
100% honest. I mean, what I liked about when I came into the office, you were very upfront about the procedure. You explained everything. During the procedure itself, I was awake. You told me exactly what you were doing. I couldn't believe how quick the time went by, and it was over. And I came in after for my 4th day. It was remarkable how I had no major bruising on my face. I had no incisions, and it already looked tighter, my jawline. It was remarkable.
Great. And then one last thing, the recovery, how was that?
It was pretty easy. I'll be honest. The first 24 hours, I was sore, painful, but I used Tylenol. It wasn't like I was sore for days. I recovered beautifully. I would say by the 3rd day, I wasn't really taking any Tylenol. And exactly how you predicted the healing process would be. I know I'm still in the healing process. I'm still a little swollen, and it's going to tighten, and I'm looking forward to that 6-month result.
How far out of surgery are you right now?
Today is actually 3 weeks to the day.
And you're on a Zoom with us.
And I'm on Zoom. I was at work. I would say 10 days after the procedure. I was working remotely. You know, I was able to do daily activities. I would say day 2 of the procedure, right after the procedure.
And real quick, before we close, you also had your eyes done with TEMPSURE.
Yes, I did.
Say a couple words about the TEMPSURE upper eyelids under local anesthesia.
No pain whatsoever. I can't believe how quick, within, I would say, a week, the stitches were out. You can't even see any type of line on my eyes. And I feel like they opened up my eyes. They made me look a lot younger. I'm going to be 56, and I feel like I'm in my 40s again.
Great. Well, thank you so much for coming on. We appreciate it. And we're going to move on.
Okay,
and,
great.
Have
Thank
a good
you.
night. Feel free to stay on.
All right, great.
So our next patient is Suzanne. This is Suzanne's photo. She was looking for further neck definition. This is her photo 4 days later. She had the MyEllevate and the Precision TX. Hello, how are you doing tonight?
Good, thank you.
So again, thank you so much for coming on. And would you like to share with them why you chose this MyEllevate procedure, Suzanne?
Well, I came in for a consult. I think I was one of your first people because it was a couple years ago. And I just had loose skin under my chin, and my neck was starting to get those bands. And honestly, I thought maybe you'd tell me something about lasers or fillers. And I think this procedure at that point was almost brand new. And so you told me, oh, we have this great new thing. And so I was excited and signed up. And it gave me way better results than I was expecting, because I was expecting like you'd put a filler in to like fill out my neck or something like that. But it was way more.
And they're looking at your pre-photo. You're someone who didn't really have this neck falling down to the ground. And if we did like a liposuction only, it would give some improvement. But the question is, when you're not that bad, if you add a MyEllevate, it adds another dimension of crispness to that neck angle. And is that what you found?
Yes, absolutely. And I noticed it as soon as you took the, as soon as we took the gauze off, it was a defined jawline that honestly I never had, like even in, even when I was 20 years old.
And I'll ask you the same question we asked Pamela. Is it what it was purported to be?
Yes, absolutely.
And would you recommend this to other people who are listening on tonight?
Yes, and I've recommended it to other people outside of yes.
Well, very good. Well, we thank you for coming on and always appreciate it. And have a good night. Stay on if you like, because we're going to get into some new things here.
Great.
Okay, moving on.
Bye.
So you just heard from two patients who had the standard MyEllevate procedure. We had done that for years, and it was great for the patients who were in their 40s, 50s, maybe early 60s. But what we found was there were patients 60, 70, 70s who really wanted to do it too. And we tightened with energy, but they just had a little bit too much skin in the back, and they had some jowling along the jawline. But we were able to create a procedure called MyEllevate Plus, which is the same procedure, meaning the whole front is not opened up, just like a MyEllevate. So you get all of the advantage of that with the faster healing, the less swelling, all of that. But we do need to make a small incision in the back just to take up that extra. And that opened the doors to patients who were much older. And not only that, when we were combining with our other technologies, with the laser tightening, with the microneedling, we are thinking it's certainly equal to doing a full facelift, if not maybe have an edge over it. So we're going to now move on to hear some patients about the Elevate Plus in a minute, but let me just show you some photos. These patients have a lot of excess skin, a lot of jowling, and just a little more than we could ask a standard Elevate procedure to do, and probably worse skin quality with less elasticity, but they all have in common, they don't want a facelift. So this is an example of a MyEllevate Plus right after. You can see we went from a lot of looseness, fat, loose skin, muscle, jowling, to that look on the right, much cleaner with the little punctures in front. And here is a whole host of patients that are right afterwards. Look at the hanging skin, look at the jowling, the loose muscle, and look at the top right. That was, we can't do a plain MyEllevate, but when we added the plus, these patients all became candidates and did very, very well. And even with these short necks that are thicker, very difficult necks to do with any procedure, looking good with the MyEllevate Plus. Here's before and afters, 2 weeks after. And as I said, they're very presentable 2 weeks later. And I can't tell you I can do a full facelift and get anything much better than that. And in fact, if I did, they'd take about 4 weeks or more to look like this. And here she is from the side, just a very nice jawline, the laxity, the muscle, the fat's gone away. This patient's 74 years old. She has lots of excess everything. And this is only 2 weeks later. 2 weeks later, presentable, clean line, smooth skin, no muscle, no fat, no jowling. Here's her 3/4 view. Little bit of bruising, but not much to speak of with this, which is a mostly minimally invasive procedure. We ask the patients to bite down and really show those big, thick muscles in front. She's biting down right after the procedure at 1 month, no muscles to be found, and beautiful neckline. And that brings us to Christopher. Christopher had lots of fat and this really big muscle in front, which you see in your photo on the left, and on the right that has resolved. And here, his neck, he has no neckline. His skin is vertical, just hanging down with loose muscle there. And here he's biting down before, biting down after, with much, much improvement. And we are fortunate to have Christopher on the phone with us tonight also. So Christopher, welcome. My first question, Christopher, is you waited, you had that appearance, and why now? Why did you move on this now to go and have a MyEllevate Plus procedure?
Well, you know, I first of all, hearing everybody's stories, I realize how typical I am, and I never realized that I was. But I always had excess skin, even when I was a child. I used to go to my mother and say, "Look what I can do," and I could pull my cheeks way out. And I originally went into you to talk about some abdominal tightening, and I just said, "Is there anything I can do about this?" And that's when you told me about the procedure. So I, like everyone else you've described, I did not want a full facelift. I didn't want that kind of downtime, and I certainly didn't want that sort of unnatural look you can sometimes get from that.
Right. And with the Elevate series, Elevate, Elevate Plus, can you just, you had a plus, so how can you describe the downtime you had with the Elevate Plus procedure?
I was amazed at how short the downtime was, even with the Plus procedure. I was on Zoom calls the next day. I couldn't believe how quickly, you know, I had to wear the neck brace for a couple of days. I couldn't believe how quickly I got that off, and that the moment you took the gauze away, it was striking, the difference between before and after.
And it's looking natural to you? Completely
natural. It is literally exactly what I wanted. I did not want to look 10 years younger. My issue was that no matter how much I weighed, I always looked heavy, because there was always this skin there. And in photographs, I always found myself having to look up because it just was so unpleasant looking to me. And now it's just so natural. I couldn't be happier.
So are you doing anything differently now, behaving differently, feeling how do you hold yourself down now that all of this has been taken care of?
Well, the first thing is that I've grown a beard, which I would never do before, because it accentuated that big turkey neck that I had. Otherwise, I just feel I'll wear open collars more than I used to. I'm not trying to hide my neck. I went on vacation in September, and all the photos are exactly me looking the way I always felt like I looked.
Great. And the last question for you, because you are unique. Normally when I do a plus procedure, which is a little in front of the ear and behind the ear, I have women with long hair where it's all covered.
Right.
We didn't have that situation with you.
Right.
In fact, you don't have much hair back there.
Right.
So how did you fare with an Elevate Plus with a small incision back there, which is certainly quite visible?
It was very easily covered. You gave me the tinted sunblock, which I've used, and that covers it. And I'm also having the laser treatments on the scars. And honestly, they're barely noticeable at this point. And only going
fade away.
Yeah.
Good.
Yeah.
Well, we thank you so much for coming on with everybody. And again, feel free to hang on with us. But thank you for giving them all of your thoughts.
Well, thank you. Thank you for giving me exactly what I asked for. So
great.
Thanks.
Have a good night.
Bye-bye.
Moving on to a return patient, we have Lewis. And Lewis was one of our original patients. He was our oldest patient. And he not only had the Elevate procedure, he was one of the pioneers, which is a procedure that's not out there across the country yet, but it's called the Elevate MIDFACE for those laxity in the cheek. And Lewis had that done a few days later, swelling, bruising going down, very presentable with that. Here he is in his 360-degree imaging right after. So anyway, that's his 360-degree. And the reason we take this special camera system here called the OVIO is because it's a video. It can show you tightening your muscles, smiling, doing all that kind of motion. And this is only in the photo here, he's only a few days later. So that's why there's a few areas of bruising. The man on the left there is Ted. Ted is also one of the pioneers of the MyEllevate company. There with Dr. Miller. Lewis proved to us early on that this was something for the patients who were older, and he did that successfully. He was a real trooper doing the ELEVATE, one of the first to do ELEVATE Plus, the first to do ELEVATE MIDFACE. So he loves this ELEVATE series of procedures because they're minimally invasive, quick recovery, and they do the job. So this is a video of Lewis's. Let me see if we can play that. He had his procedure, and then we asked him how he was doing minutes after the procedure.
I can't believe that I just finished this operation and I'm going home and I have no pain, I have nothing, absolutely nothing. This is perfect. I couldn't ask for better. I meet with my friends over the telephone, a Zoom call, and every other week. And yesterday, they knew that I had a cataract operation, and when they saw me, the first thing they said, Lou, you look different. What did you do? You look a lot younger. So, and they have no idea what we did.
So, Lewis, you're like 2 weeks now after the neck procedure. So what do you have to say now after 2 weeks?
That I'm absolutely elated. This is fantastic. Very easy. I will do it again with my eyes closed. No pain. The results are fantastic.
I know it's only 2 weeks, but did anyone you came upon notice anything?
It's unbelievable. People come over and look at you and are you losing weight? You look younger. What are you doing? It's unbelievable. They can't figure it out because it's so natural.
What is this? Why is this so popular today? Because we can now treat all aspects of the neck, the muscle, the skin, the fat, in less than an hour with local anesthesia. On a regular ELEVATE we can perform in the office. It's a fairly fast recovery, and it's one of the great modern breakthroughs in facial aesthetics. Again, thanks to Dr. Greg Miller, who you heard today. It's been featured in ELLE magazine. It was the top procedure in 2021, otherwise known as the Zoom lift. And that's what they had predicted one December ago. And they were very, very correct in that has become so popular here on the East Coast, on the West Coast, and down in Florida. Very popular where Greg is in Beverly Hills, the Hollywood jawline. And that's the look that people are going for, but they want to get there easily. And that is what this fulfills. We're going to just talk a little bit about the aging eyes, because when someone looks at you, they do look at your neck. That gives away your age. But the other, and maybe the first area that gives away your age, are the eyes. They look at your eyes first. And if you have that excess skin, that drooping, that also coincides with an aging look. So the new breakthrough here that we did research at New Jersey Clinical Research Center is on eliminating scalpels and cutting with energy in the office, local anesthesia. And this device is called the TEMPSURE surgical. In our study, we looked at 10 eyelid patients, blepharoplasty patients, using the TEMPSURE surgical. We monitored them with high resolution photography and other instruments and biopsies to look at what was happening. So with a regular blepharoplasty, skin is removed. And this is with this instrument, there's minimal bleeding, no hot thermal energy. It's a clean cut. We used to use scalpels, but we use these little tips with energy. What you're looking at here is a scanning electron microscope, which magnifies the skin 10,000 times. These are actually the little collagen bundles that make up your skin, collagen fibers. You can see on the left, when you use a scalpel, the fibers are all irregular and torn. And when you bring the wound back together, the body has to fill in the gaps with scar tissue. When you bring the TEMPSURE back together, they fit perfectly. The body has to do minimal work for healing, and that's why you have minimal scars. This is an instrument called the VIVOSITE, where we can see scar tissue underneath. If there was scar tissue, it would be black under that arrow, and we saw very little scar tissue at all. When you look at the real images of the patients 3 months later, you can see the scars or not see the scars. Very, very nice, very different than what we were used to for the past 20, 30 years. And I think this instrument, not only for eyes, but work we're doing now, is going to bring it on to all other surgical procedures. And I think it'll be revolutionary that we're now departing from using the scalpel for hundreds of years and now moving on to energy to cut with, just like they do on Star Trek. And here's some eyelid pictures using TEMPSURE surgical, very natural, very clean cut, fast recovery. So anyway, that concludes what I have to say, and I'll be back for questions. And again, thank you to the team, and thank you to the doctors, and thank you to our patients for coming on tonight.